Hello, my name's Kate. It has just gone 6 o'clock in the morning and I'm getting ready for work. I'm going to attempt to show you some of what our day involves as a critical care nurse. In terms of a regular day, I'm not sure that 2 days have ever been the same on critical care. So yeah, let's get ready and let's go. See you in a bit. It's now 7:20 in the morning. The first thing we do is we come over and look at the allocation board, see where we're allocated to work for today. And then we're going to go in here and I'm going to get safety briefs. I can't take you in because of confidentiality issues, so I'll see you in a minute. We've just come out of safety brief. Now we're going to go and get a handover on our patient. Now obviously I can't show you an actual level 3 patient, so what we thought we'd do is set up a simulation if you'd like to follow. Morning!
So this is 38-year-old Jenny. He's had a recent sort of shortness of breath and productive cough. He presented at A&E, he was desaturating down to about 70%. He's had a chest x-ray and it shows really nasty bilateral consolidation to both sides. So he's transferred up to us. Where we're at now, so we're quite one.
So one of the first things we do after handover is our safety checks for our patient. So we would check the size of Bob's ET tube, what it is at the lips, how many days it's been in situ, the cuff pressure, the grade of intubation. We write down the dates that the lines went in so that we can keep an eye on when they need renewing. We've got our body map with when cannulas went in, any marks on the skin, and all the equipment that's attached to Bob. We would check the monitor, the vent alarms, any infusions that are going, where they're going to and the rate, and keep an eye on our target settings. So it's 10 o'clock, first drugs round of the day. Drugs on intensive care are slightly different to anywhere else really. We've got a lot of continuous infusions. We go via different routes. The concentration of the drugs, the strength of the drugs and the rate that we can give them all change. It's now 10:30. Morning drugs are done for now and it's time to reposition Bob. Obviously we do this regularly for pressure relief. It's made a little bit more difficult because we've got a level 3 patient, so it takes at least 3 members of staff. So we're going to give him a little roll, check all his pressure areas and give him a little freshen up. So one of the things we have to do here sometimes is take our patient for an x-ray or a CT or sometimes transfer to another specialist hospital. And as you can imagine, transferring a level 3 patient is essentially taking all of ITU with you. If we're requiring to go anywhere in an ambulance, we've got a trolley set up here. We've got a transfer ventilator with a tube in there, a bag which essentially contains all of ITU in it, a defibrillator, absolutely everything that is around my patient now is here in a form that we can take somewhere with us. So we're headed into the afternoon now. Throughout the year, we run regular sim sessions just as training of what it's like when an emergency situation happens on critical care. So everybody has to work together. You know, you've got a patient where one or more organs are failing. Everything needs to happen in a quick, efficient way. So, you know, it's difficult to describe to you what it's like in real life. That's where the training from these sims really comes into its own. So we've just come out of that sim situation. So as you can see, there's lots of different roles involved in critical care in all the situations. This is Annie. She's going to introduce herself.
Pnawn da, Annie dwi'n gweithio fel ymarfer uwchradd ar yr uned credigol yn Wrecsam. Ar ôl ddechrau fel nyrs, dwi wedi datblygu sgiliau uwchradd yn cynnwys gradd meistr sy'n gallu fi weithio ar ochr a gydag doctoriaid ar y cyfrestyr meddygol. Mae'r swydd yn bwysig oherwydd fel nyrs mae gen i rhagolwg gwahanol i'r doctoriaid. Hefyd, mae doctoriaid yn symud swydd bob 6 mis i flwyddyn a da ni fel tîm uwchradd yn yma trwy'r amser i ddiogelu parhad. Rhan o'r swydd ydy asesu'r cleifion ar yr uned ymarfer dwys ar ward a penderfynu os mae angen dod â'r person i'r uned credigol am fwy o llawdriniaeth. Rydym hefyd yn gweithio fel parhan o'r tîm argyfwng a trauma. Mewn amser dwys yn aml mae pethau yn anodd, ond gyda amser a cefnogaeth mae hyder yn tyfu a mewn dim amser da ni'n sylweddoli na ni sydd yn rhedeg y sefyllfa. Yn aml mae'r sefyllfa'n anodd, ond rydym yn gweithio gyda tîm anhygoel a cefnogol.
Enw fi di Rachel, dwi'n nyrs, dwi wedi bod yn nyrs am 11 blwyddyn, naw yn yr uned criticol. Dwi wedi dechrau'r swydd newydd yma chydig o fisoedd yn ôl, fel ymarfer uwch ar yr uned. I ddechrau fod gynnau ofyn a pryder yn dechrau'r swydd newydd, ond hefyd mae gynnau cyffro am yr sialens o flaen fi. Dwi'n gobeithio dechrau'r gradd meistr yn mis Medi. Mae yna lot o cyfrifioldeb, mae'n hyned o cyffroes, ond dwi'n edrych ymlaen at yr her nesaf yn y swydd.
One of the things we do here is regularly interact with the family. So you would call the family, update them with the situation, what the plan is. So what we're going to do now is talk to two members of our follow-up team, Kate and Hayley.
We follow up every patient that's been with us on ITU 4 weeks after hospital discharge, and we give them the opportunity to come back to our clinic and discuss anything that happened to them while they were here and any issues that they've had since going home.
The reason why we do this is, why do we get our patients physically well if then for them to be psychologically not right then? So doing the follow-up team helps the psychological side of it as well as the physical afterwards.
It's the end of the day, and I just wanted to give you a small snapshot into what life is like as a critical care nurse. And it's really difficult to get our job across like this. I've just managed to grab one of our consultants. He's just going to explain his view on us lot.
Critical care nurses are vital really to the service we provide. They have to be so clued up in the knowledge of dealing with critically ill patients who have multi-organ failures. They have to be knowledgeable technicians. They've also got to be there with the patients all through to watch their response to any treatment that they're giving. They have to deal with the aftermath of making sure that the patient is understood. But I think the one thing that really gives the most respect for me is that how they act as patient advocates, how they are there for the patient in their most vulnerable, their toughest times, reassuring them along their journey. And that's what really moves me emotionally when I see them at work. Sitting there, talking with the patients, singing with the patients, doing all of these things that makes a difference between good care and great care, makes a difference between a good nurse and a great nurse.